So you can ask any speaker now.
And my question, in fact, is to the panel, and thank you very much. I mean, this morning is an excellent example of how evolutionary formulation can give a context for psychiatric presentation. I was hoping to hear the term cultural evolution in this morning, although it was said indirectly. The mismatch hypothesis has featured in almost all the three presentations, maybe. And earlier there was a comment about bereavement and how it is being included. And I would argue that this is possibly another example. I mean, Bachelor, a French sociologist, talk about the impact of bereavement nowadays is bigger because of the nuclear family, as well as the system of mourning, which offer the social support. So my question is, as a group of psychiatrists, psychologists who are interested in evolutionary formulation, how could we use insights from cultural evolution, in fact, in our formulation, but as well, in fact, how could we use them politically to influence, in fact, what's happening in terms of policies, in terms of guidelines, in terms of classification systems?
So Dr. Abed is a little surprised that he's not heard more, Dr. Abbas, that he's not heard more about cultural evolution and how should we as evolutionary psychiatrists be thinking about that, and what use could we make of the concept of cultural evolution in terms of advocating for policies, etc. Can I ask Professor Tracy to begin?
I can leave the microphone here? Yeah. Okay. So I think it's a very complex problem, because the naive view that there is just an opposition between biology and culture, it's not longer acceptable. Many aspects of human culture are just, emphatization, if you want, an emphasis on some biological predispositions. Other aspects are really something going wrong in terms of natural adaptation. I'll give you an example based on my clinical experience. Adoption, the process of adoption, okay? Of course, our culture values adoption, but the rules for adoption, at least in Italy, but I think it's so different here, is that you are ready to adopt anyone, okay? So they give you a psychological examination to be sure that you are mature and ready to adopt anyone. So I saw people that was classified as not mature because they refuted to rejected an adoption with an adoptee that was about 16-year-old with important disability from another places, another culture, and so on. This is absolutely natural. The real drive for adoption is to have a very small child that you can consider your biological child, that is absolutely healthy, and of your same cultural group. Okay, so we have to consider that some cultural impositions are very far from our natural predispositions. At the same time, I agree 100% with Thomas Huxley, that was the friend of Charles Darwin, that say never base ethics on biology. We have to say that our ethics should be very different from our biological predispositions. But the task of clinicians is not to outline ethics of human behavior, is to help the single individual to reach well-being. And for doing that, I think it's very important to know our evolutionary predisposition, even if we hate these predispositions that sometimes are really bad.
There's someone at the back that's been waiting patiently. Yeah.
Thank you. My question arose when I heard Professor Troisi's talk. Obviously, he gave us a lot of information about data gathering. And just going back to what has just been mentioned about evolutionary formulation, I was thinking along lines of we have etiological formulation, we have psychological formulation, is there a framework where we can, where we have a grid, like for example, in the other formulations we have predisposing, precipitating, perpetuating factors. Similarly, do we have a grid which we can relate to, so that when we gather information during a history taking or observations, we put it into this grid, and it gives us a formulation on evolutionary basis, which will be easy for us to teach as students, or obviously even explain it to the patients themselves.
So the question is to Professor Troisi, and it's about data gathering and how could we add to biological and psychological formulations, perhaps evolutionary formulations, in terms of some form of standardized grid.
Yeah, you know, I think that it's very important to promote integration. I really that it's a big risk of modern psychiatry is the opposition between the biological psychiatry and social psychiatry, even if biological psychiatry is not really biological, you know, it's organic psychiatry, because biological psychiatry, of course, should be based on the evolutionary approach. But the integration of the different perspective, I think, is very important in the clinical work. So collecting data coming from very different perspectives that should be integrated in a general framework. In terms of grid, as you say, I don't know that there are grids ready for that kind of task. You know, I think that a very interesting promise is the NIMH doc. If they are revisited in terms of evolutionary approach, you know, because what they call construct should be behavioral systems in reality. We have behavioral systems that are in integrated systems of biological mechanisms, social inputs, and psychological mechanisms to process information. So I think that if possible to translate what they call construct in behavioral system, this could be very useful for clinicians and researchers.
Thank you.
So we've had a very rich morning from different perspectives. I've certainly learned a lot, and I'd like to close by emphasizing the importance of narrative formulations. We can't reduce everything to numbers, to grids, to tick boxes. We need narrative formulations, credible narrative formulations in which we integrate perspectives. In terms of my training, I was thinking, when I started training, in fact, my consultant said, let's admit this patient to observe them. And Bloiler lived with his patients. And we don't, and I genuinely feel we are missing a lot. But anyway, we've had a fantastic morning, so thank you to all speakers, and you can ask them questions at lunch.